Hi, welcome. I'm Dr. Khaled Sadek and you're watching my fantastic YouTube channel on cysts and lipoma removal. Hi, welcome. I'm Dr. Khaled Sadek. You're watching my fantastic YouTube channel on cysts and lipoma removal, and today we're in a special location because we're at the Battersea Power Station here in London. Check that monstrous building out, those massive chimneys. Used to be an old power station, no longer in use, being redeveloped. Apple are going to go in there. A couple of houses are going in there. But today, there's a hula hoop lady. Look at that. Check her out. Wow, look at that. Her hula hoop skills are probably better than my lipoma skills. And we've got a real treat for you today. We've got cysts, 2 cysts behind the ear, which we're going to take out. Check it out. Check out the pier over there. We've got the London skyline at night looking very, very beautiful. We've got the American embassy over there. So all of our American viewers, that's where Donald Trump has stay when he's in London. Across the river, we've got Chelsea. And look at this lady. Look at this lady go. Wow, she is great. Look at that. Wow. Wow. So remember to subscribe, like, follow, share, comment down below. Remember to press the alert button, and most of all, also follow me on Twitter and Instagram. But most of all, enjoy the video. Until next time, bye bye.
Might go down.
Yeah, of course.
This might happen.
Okay, I'm going to put a drape on you, okay?
Okay.
Can be a little bit claustrophobic. This is the worst part, it's the scratch. Well done. Okay, as we inject, it's got a bit of adrenaline, so it stops the bleeding as well as giving a bit of a local anaesthetic. And it's a very good anaesthetic, it works really quickly. So how long has this one been here?
I've had it for 6 years.
6 years, okay.
But like I said, last year it trebled in size.
Trebled?
Yeah.
Okay. Is your skin quite prone to cysts, or is this the only one?
It's the only one.
Okay.
But I went through the National Health, and I've been referred to 3 hospitals.
Yeah.
And they all said that it's not
Cosmetic.
It's all yeah, it's cosmetic. So no.
Let me know if you have any pain at all on this. Is that alright?
It's fine.
Yeah, that's the thing. A lot of these cysts, unless they get infected, they class them as cosmetic, which is a little
It's on the face.
Huh? Yeah. Well, because it's benign. It's not cancerous. It's not causing any pain, discomfort. It's not getting in the way of anything, so it doesn't, unfortunately, cross the threshold for treatment, which is a little bit unfair.
I went through the stage where it was getting me really down because of constant asking and things like that.
Yeah. Well, that's not fair, is it? Okay. It's just. I'm going to drain this out, okay? So just press it, get all the stuff out, and then we'll go and chase the cyst from underneath, okay? It is a little bit smelly. You'd expect that. 5, 6 years, you say?
Yeah.
Yeah. It's definitely going to be a little bit of a whiff to it.
what's the chance of it coming back?
Well, you
Minimal.
know, we're going to try to get the sac out so it doesn't come back. What I'm trying to do is get a stitch into the sac so I don't lose it, and it gives me a bit of traction to pull on it gently, because they're very, very friable, and even a small amount of pressure will rip them apart.
Yeah.
And then you may lose it forever. So that's the stitch in place. So if you feel any tugging, that's because I'm pulling at it. If you feel any pain, let me know. But you are doing fantastic, okay?
Yeah, I've got quite a high pain threshold.
Really? Give me some examples.
Well, I sprained my ankle,
Yeah.
and I went and done a 12-hour shift working on my feet work.
Serious?
Yeah, and then went to St George's and they said, "Why? How are you still walking?"
George just said that.
Yeah.
And they see some pretty gruesome stuff.
Yeah, they just like said, "How are you still walking?"
How are you still walking?
Yeah, they said that I should have not been able to continue, especially doing 12-hour shifts on my feet.
Good on you. What line of work are you in?
Security.
Security, wow.
Yeah.
So you really got to be on your feet.
Yeah.
George is a great hospital. I actually trained there myself. It's the mothership.
Yeah, it's a good hospital. Chelsea West are quite good as well.
Yeah, that's our local hospital. Were you born in London?
Yeah, I was born in a hospital that's no longer there.
Which one?
Balham, the Weir.
In Balham, really?
Yeah, there's a hospital there called the Weir.
The Weir?
Yeah.
Did they just merge that with George's?
I don't know. It was gone.
Long time ago.
Yeah, long time ago.
Weir, yeah, that's a shame. There's a lot of hospitals on that stretch, all the way up to Kennington, that have shut down. There's the old Children's Hospital by Oval, or Stockwell, I think.
I don't know that one.
It's an old Victorian one. And even George's used to be what they used to call the fever hospitals. So in the old Victorian days, patients would have these fevers, which they didn't know what they were, and they didn't have antibiotics. They just had fevers, and medicine wasn't advanced. They knew that it was contagious, so they would put them outside of the city, right outside. So, yeah, toe-tooting. So there's lots of these old Victorian fever wards just outside George's on Blackshaw Road, which you've probably seen. They're all boarded up. They look like Dickensian workhouses. You might find Oliver Twist and Fagin working away, making.
Okay,
Yeah. This is a deep sack, isn't it?
Yeah, for a long while.
Hmm?
Been there for a long while.
It has been a long while. You gonna miss it?
Not really.
Not really.
Not
Fair
really.
enough. Did you name it?
No, it was a pain. It didn't deserve a name.
Did your missus name it?
No,
No one's named it.
no one named it.
Fine. We'll just pretend it wasn't there.
Yeah,
Alright, that's a deal.
just a scar or a moment.
Yeah. You can make up another reason for the scar.
Nah,
Battle wounds.
Tell people the truth.
Yeah?
Yeah, why not?
What do you tell them?
Tell them that it was a cyst.
Yeah.
Yeah, it's gone.
So what I'm doing is I'm really trying to gently pull this little sac out. you can't see, but the camera people can see how very delicate and thin it is. And got to be really patient. Can't go in and just chop it out like a lumberjack. You got to really give it a bit of respect. Tissue respect is really important when it comes to surgery. So it's got a bit of fascia attached to it.
Bit of fascia, what's that?
Well, you know when you open a joint of lamb,
Yeah.
and it's like full of this like silvery cling film stuff?
Bristle type.
Yeah.
Yeah.
That natural cling film is biologically known as fascia, and it's there to help all the muscles and the joints slide over each other. And that's what this is. Just trying to keep everything supple and mobile, because the face is a very animated part of the body, you know. You don't need me to tell you that. And so to keep it all animated, we need to have everything sliding over each other nicely.
Yeah.
And so you have tons, like football lengths of these sheets, these biological cling film. Like, I call them biological cling film because it's probably the best way to describe them.
Good analogy.
Thanks. Okay, that is the sac out in its entirety. So we emptied it and then we pulled it out. Fantastic. So
That's all done.
well, then I'm going to put a stitch in and close you up because I can't let you go home open.
No, that's not a good idea.
No, not a good idea. Because, you know, we want to look looking good, right?
Yeah. So basically, the antibiotics you're going to prescribe, then not penicillin, are they?
We'll see. Actually, I think you might get away with not having antibiotics, to be honest.
No, because I'm allergic to it.
All right. So definitely not going to have penicillin.
No.
Well, the alternative is something like erythromycin. Erythromycin.
I think I've had that before.
Yeah. What kind of reaction do you get when you take penicillin?
Everything.
Everything. Okay.
Everything.
Full Monty.
Yeah, blow up.
Blow
rash,
up.
Yeah, rash. Sickness, diarrhea, the whole lot.
Sickness, diarrhea. Gosh. Okay. Well, I don't want that happening to you. You're gonna like this scar, even if I say so myself.
I'm going to like the scar.
Yeah, it's a good one. You're gonna like it better than the cyst, anyway.
Oh, good.
Yeah.
I'm on the wrong side of 25 to the point that one now anyway, so.
Nah, come on, don't be like that. We've got a fantastic summer ahead of us. Summer of 2019. It's got a ring to it.
Yeah. I hope so. I hope it's going to be a period.
Yeah, new man. You're gonna have women running after you after this.
I can't, don't tell the wife that.
Right, I'm gonna put a dressing on your face and then you are good, my friend.
Perfect.
The dress is quite epic compared to the actual lesion. So don't be alarmed by that.
Oh, I was going to cut. Oh, did I discuss? Oh, well, you said about not really having antibiotics. I was going to cut a couple of pints. Today's a nice day for it.
Yeah, you can have a couple of pints.
Yeah.
Have a couple of pints on me as well,
I will do.
although I don't drink. Have a non-alcoholic beverage.
No, not alcoholic.
Non-alcoholic for me.